I'm not so sure that this is a routine that they're using every single day. I think a lot of times it's done for the video because I look at the ingredients in all these products and I just can't imagine someone using all of them every day without significant irritation. So I see a lot of that.
Hi, Skin Friend. Thanks so much for tuning in to this week's episode of The Skin Reel. This week, I had a lot of fun recording with Amy. She is a cosmetic dermatology physician assistant in Miami, Florida, and she is also the founder of a very vibrant community for Skinthusiast. And actually, that's the name of her podcast, her website, and her online community where she is really, really active and really just on a mission to help decode the often confusing world of skincare. Hello, I totally can relate to that mission, Amy. But it was a lot of fun. I got to be a guest on her podcast not long ago. So be sure to check the Skinthusiast out as well. And we have very similar approaches to skincare, right? Like the theme is simple, consistent. And I love how she tells people to look for ingredients that treat your skin concern rather than just shopping for actives that you've heard are good or helpful, to make sure that you're tailoring your skincare to what you actually need. And that's totally on brand with my mission, right? Of like, know your skin needs, know your skin goals, and that's what makes your skincare habit. But she's going to be sharing with us how she approaches skincare and skin health in Miami as someone who not only provides dermatology care, but also struggles with melasma herself, and sharing some of her tips and pearls with that. You are not going to want to miss this episode. I'm so glad you joined in. Amy, thank you so much for being here. I had so much fun being on your podcast and listening to your podcast, and I'm thrilled that my audience gets to hear from you all your great skincare information and education. So thanks for being here.
Thank you for having me. I'm really excited to be here.
So you are a dermatology PA in Miami, and you also have a really vibrant podcast and community called the Skinthusiast. So can you just tell us a little bit more about what you're up to in that community?
Yeah, so it's a very interesting start. So I started the Skinthusiast community about 6 years ago, but it actually started before then. I started actually talking about lifestyle and style, and I would talk about my skincare when I was a critical care PA. So I was working in the ICU. I had a very high-stress job, weird hours. I wasn't yet married, didn't have kids, and this was kind of like my creative outlet. And once I started working in dermatology under Dr. Leslie Bauman, and I started talking more about the science of cosmeceuticals and skincare and our skin health, I started to realize that's what people wanted to hear from me. Like, they really weren't interested in the rest of the stuff I was talking about. So I really pivoted to a skincare-focused account, and that's kind of when things started to grow. And I noticed, especially a ramp up during, the pandemic, there was a lot of misinformation on skincare online. And so I really started honing in on the educational aspect of it and trying to educate on ingredients and routines and the things basically I was educating my patients on in clinic. But I know that's not always accessible to everybody. Our visits are longer. It's a little bit harder to get into our clinic, and they're not free. So I understand that not everybody has access always to a dermatology provider. So I wanted to be able to give some of those tips that I felt for me were life-changing and were really life-changing for my patients to a wider audience. So it became a blog, an Instagram, a TikTok, and then slowly then became a podcast. Once I started connecting with all these other amazing skin experts, I realized I wanted to be able to bring their points of view on to a show and really disseminate it to my audience.
I totally echo everything you said. Like, it's hard to see a dermatology provider. Like, there's not enough of us out there. And also the way our healthcare system is set up, especially if insurance-based, right? Like, they're quick visits, they're rushed, they take months to get in, and it's hard to address everyone's concerns. And then there's all this misinformation out there, right? It's so easy to have your voice amplified in today's world. And that's good and bad, right? Because there are people out there putting out information about skin that really have no education or knowledge about it. And then people are confused and overwhelmed. So yeah, that's 100% why I started my podcast too, is just to give people who maybe can't access a dermatologist or are unable to get in or just feel like they're not getting all their questions answered, just to give them really good information So I love that you are doing that. And yeah, podcast is a great way because, Instagram and all that, you've got about 60 seconds, right? Or maybe even less to teach. So having the podcast format is nicer because we can really delve into things. So I think that's wonderful. I love that. And yeah, I find like this is where people get their information nowadays, right? It's not in those four walls of the clinic visit.
Yeah, one of the reasons I started the podcast is because I am a podcast consumer. I have listened to podcasts for years. If I want to learn about something, I look up the topic and I try to find an expert and I learn about it from them. So I actually was going to start the podcast a year and a half before I did, but my daughter ended up coming early. So it got put on hold. Then finally, the time she was like a year and a half, I was like, okay, I have some extra time. I'm ready to do this. And I find, I'm sure you do too, that like the podcast crew is so different than the crew who finds you on social media. I think it's a very like special group of people who like to listen to podcasts. Like often I find like myself like very nerdy. I love to go deep into the information. So I find that there's just a lot more of an appreciation for the science from the podcast listeners.
Yeah, absolutely. But it is fun. At least most of my episodes now are with guests. But yeah, sometimes when you're doing the recording, you're like, is anyone listening to me out there? But then you'll get that feedback that, oh, yes, people are listening and it is making an impact. So I think it's important that people who do have knowledge about the skin have the loudest voice out there, because otherwise this vacuum is going to be filled. And skincare a lot of times is equated with beauty care, which I have a few issues with that. One being it leaves out a lot of people, especially men, who may feel like, well, I don't want to worry about skincare because that's beauty care and products and all that. But also our skin, sometimes we just stop it. Oh, it's just for like aesthetics or how you look and all that. And we forget like it's actually this important organ system and it works in conjunction with the rest of our body. So of course, yes, we want to look good because when we look good, we feel good. But there's more to it than just that. So I would love to just hear your approach to skincare because I think we're in alignment on a lot of things. But how do you approach skincare?
Yeah, so I have always had a relatively simple approach to skincare, even before I worked in the field. But I started to find that my patients were coming in with a lot of irritation, dermatitis, new breakouts that they weren't experiencing before. And when I was delving a little bit deeper, I always tell my patients, bring all your skincare with you, bring the whole bag. And so I can look through everything. Once I can diagnose your skin type and look at your skin under the Visia camera, then we can go through what you're actually using. And I was finding these routines were incredibly extensive. And when I asked them, why are you using all these products together? There was so many different acids, or they'd have 3 products with retinol in it, or everything had niacinamide. I realized it was because they were watching TikTok routines. And what was happening was either they were watching creators who were basically made famous by these extensive 10-step routines, which there's a lot of creators out there who do those ASMR routines and they have 10 to 15 steps sometimes, or they were watching people with 5 to 7 steps, but they were taking from everybody and they all of a sudden had this very extensive routine that was creating inflammation and irritation. So once I started to see that, I realized that a simple skincare routine wasn't the norm anymore. I started to really hone in on that kind of education because I realized that they weren't getting it elsewhere. But simplification is always the name of the game for me. I am 3 to 5 steps in the morning, 3 to 5 steps at night. Often it's just 3. I'm busy, but I want to make sure I'm hitting the points that have clinically been proven to improve the skin. The rest to me is just fluff. And I'm a skin enthusiast. I love when new products come out. I love when we have new information on new ingredients, but I think you have to always keep in mind your core routine and what we know actually works. Doesn't mean you can't explore, but as you mentioned, when you were on my podcast, consistency is key. So having that core regimen that you use consistently for months, for years, is what's going to make the most impact on your skin.
I love that you mentioned that. I see that too. And it's hard not to think, oh, I need this. Oh, I need that. Oh, this is the new hot active. I need to include that. And they don't realize, oh, it's actually already in something you're using. And then it backfires, right? Like they're not getting the results they want with these multi-step complicated routines because it's just too much and your skin gets damaged and it backfires. So, it's expensive and people get frustrated. And so, yeah, it's like pare it down. You can, start with like the foundation basics, and then you can add on some extras based on what your skin concerns are, or if you have fun with products, add on some extras if you like, for sure. But yeah, I find that kind of message doesn't sell products, right? And that's what a lot of these skincare companies are trying to do, is sell products. So it's up to like us as the people who are providing dermatology care to say, wait a minute, you don't need all those things. So walk us through like your morning routine and then walk us through your evening routine.
Sure. So in the morning, as far as my skincare products go, I am either cleansing with a very gentle cleanser or I'm just splashing with water. And then I'll do my vitamin C product. And then depending on the weather, like right now it's really hot and humid, so I'm pretty much just going straight in with my sunscreen because most sunscreens now have moisturizing properties. Like I don't find I always need an extra moisturizer. But in the drier months, or certainly when I'm traveling outside of Miami, I'll do moisturizer and then sunscreen. At night, I do always double cleanse. So that's really important for me as someone who's acne prone. I find that just making sure I'm removing all of my sunscreen is really important. I wear tinted sunscreen every day because I have melasma. So it's easy for me to see if I'm not removing it all. And I find a double cleanse really is what it takes. So that will be either just a swipe with micellar water as a first cleanse or maybe a cleansing oil or cleansing balm and then go in with my gentle cleanser after that. And then I'll usually use either a retinoid or some sort of acid peeling pad and then moisturizer. So it's, I say 3 steps. I guess the double cleanse would count as 2, so maybe 4 steps at night, but 3 to 4 in the morning, 3 to 4 at night. If I'm trying out a new product, I will swap that in for something else. So I won't usually add it in. Like if I'm trying a new serum or an essence that I'm, testing out for a brand, I'll usually stop the other active in its place just to make sure I have sensitive skin. So just to make sure I'm not irritating the skin.
Great advice. And as I just got back from the beach with my kids and they were using mineral-based sunscreens, and I'm laughing because they'll shower and then they'll come out of the shower and like, of course, like sunscreen all on the sides of their face. Like it's hard to get that water-resistant mineral-based sunscreens off. So yeah, that is when like doing that second step, using more of an oil-based or the micellar water can really be helpful to get that sunscreen off, or if you have a lot of makeup on. So that can be really helpful too. Because yeah, those sunscreens are hard to take off.
Yes, and the double cleanse doesn't have to be irritating or harsh. I think sometimes people think it can be harsh on the skin, and it certainly can be if you're using the wrong cleansers. But if you're using really gentle surfactants, oil-based cleansers, it shouldn't be irritating your skin.
I think sometimes you hear double cleanse, you're like, okay, I'm just going to scrub extra hard that second time. But really, the point of the double cleanse is to have more of an oil-based cleanser first that's going to grab and trap that zinc and titanium dioxide, that makeup, and then follow it up with your gentle cleanser. That's really what a double cleanse is. It doesn't mean just like scrub extra hard one more time.
Exactly.
Talk to us about melasma, because you were saying you struggle with melasma. You live in Miami. What do you do? Because right now it looks pretty good from here. So tell us about how you manage your melasma.
I actually developed melasma in my early 20s when I was on the birth control pill. This is something I'm very passionate about. I think oral birth control pills are amazing, but I wasn't given the education that I could develop melasma if I wasn't really diligent about sun exposure. And this was back in my tanning bed days, which I'm embarrassed to even say I used to do. So anyways, I've had it since then. It's ebbed and flowed throughout my life. It was under great control before I got pregnant. And then, of course, it flared during pregnancy. And since then has been kind of a rocky road to get it back under control because we now live in Miami where it's always sunny, it's always hot. So it's always in the back of my mind. It's always a struggle. So I do use tinted sunscreen every day because we know that tint does protect from visible light, which can make photosensitive conditions like melasma worse. And I reapply when I can. I'm always wearing hats, staying out of the sun in midday hours. We really don't hit the beach too often, but when we do, I'm always under an umbrella. You will never see me with a tan unless it's a sunless tan. So I'm very diligent about sun exposure, not only for my skin health, but also because of that melasma. So yeah, it's something I feel very strongly about. It's close to my heart. I have a lot of patients with melasma because of where I'm at in the country. So it's something that I find I have to educate about a lot. I always say, we can get your melasma under great control, but one 20-minute walk outside without adequate sun protection, it's coming right back. And that's something I experienced early on. It was a beach day that I didn't reapply. I was under a hat, under an umbrella, but I didn't reapply my sunscreen and it was hot. And I got in the car and I looked at myself in the mirror and it was like immediately it was back. I couldn't believe it. So heat, as we know, can also worsen it. So I don't do hot yoga anymore. I don't do saunas. I don't do the steam room, all those things that increase heat in the skin. The other thing I have to be really careful about is irritation because we know there is a vascular component to melasma. So whenever I get irritated or flushed from too many actives, I will always notice that my melasma flares after that. So a lot of things to keep in mind. But one thing I like to tell people is if it's not something that bothers you terribly, you don't have to be as obsessive about it as I am. But it is something, my job is to have good skin because I like to educate on skin. So it is something I have to unfortunately take pretty seriously.
Yeah, well, those are all great tips. And have you ever needed to do like peels or had any resurfacing? And have you ever had to take like tranexamic acid?
Yeah, so I've done it all. I have done a series of peels, which has been helpful. I did oral tranexamic acid for a short period, and it was very helpful. I've done topical hydroquinone, which is helpful. A lot of these therapies, especially the topical hydroquinone, are short-term therapies. With melasma, there's kind of a treatment phase and a maintenance phase. So I have cycled through a lot of these treatment phases, various ones that I've been testing. And hydroquinone is obviously the gold standard. It's helpful. One that didn't work for me was cysteamine, actually. It caused a lot of irritation. So one thing I always say is even if it's a product meant to treat your concerns, if it's really irritating your skin, it's not the one for you. So that's one, unfortunately, I couldn't use. But
melasma is tricky, and I think it's so important to educate people that it's not something you're going to come in, we're going to do one procedure, and it's going to be gone, right? It takes time. A lot of times we have to move really slowly with melasma. And to your point, right, there's that treatment phase to get it better, but then there's rigorous maintenance, right? Because sun, estrogen levels, heat, they can flare it. And I do find of course, now LED lights are the craze, the at-home devices and everything. And yes, they can be helpful, or saunas. Everyone I know is getting a infrared sauna in their house or going to the gym to get one. So those have great health benefits. But if you have a photosensitive condition or melasma, it can make it worse. So even if you're hearing all these great stuff about these devices, it may not be right for you if you struggle with melasma because it can make it worse. And I think sometimes people don't recognize that. They maybe realize the sun and hormones, and they don't think about heat.
Yes, absolutely. I always tell people that when they're talking about LED masks, I always say blue light for sure, avoid. And if the mask is emitting any heat, even if your face is getting hot under the mask just because of the occlusion of the mask, it's not a good idea. You have to really tailor it to your own needs and how your skin feels.
Yeah, absolutely. Well, thank you for sharing that journey with us, because I know melasma, it's a tough one. It's hard.
Yes.
Even dermatologists and derm PAs and skin experts, we don't have all the secrets, and we struggle with skin stuff too, just like everyone. So
in melasma, acne, these things have no cure. So the best we can hope is to manage it as best as possible.
You're on TikTok and social media and lots of trends out there, lots of hype. I would love to know, what are some of the trends you're seeing out there where you are like, please stop, or bust some myths for us?
So obviously the hyped 10-step routine for me is honestly hard to watch. I think a lot of times, at least this is what I think when I see these videos, I'm not so sure that this is a routine that they're using every single day. I think a lot of times it's done for the video, because I look at the ingredients and all these products and I just can't imagine someone using all of them every day without significant irritation. So I see a lot of that. And I think always, looking for the next best thing at the expense of the basics. We know that sunscreen, vitamin C, and retinoids are 3 of the most clinically proven ingredient or types of products we can use. And people don't talk about it as much anymore because it's not as sexy to talk about, because people already know. But really, that's where the core of our skin aesthetic health comes from. So those really long routines annoy me. The DIY skincare, and I think there can be a place for it, especially these. I never want to discount the more ancient rituals that are being shared on social media, because I think it's really beautiful, and these skin and hair practices that have been passed down from generations. But I'm talking about the crazy TikTok stuff where people are making their own, lemon face mask.
I've done that, by the way, when I was younger. Yeah, I mean, I get the appeal. When I was a teenager, I took avocado. It wasn't ripe, so I had chunks all over my face and lemon, and then it burned. But yeah, I mean, I get it because I've done it, so I can see the appeal. But yeah, I'm totally with you on some of those DIY, or saying the flaxseed oil or flaxseed mask is Botox. Well, no.
It's silly. And, I think what is sad is that it's become so much about the click and the views that it just gets more and more outrageous. And this isn't exclusive to quote unquote influencers. We're seeing it in the healthcare space too, there is some fear mongering because people know it's going to get clicks. So I think you have to find that healthy balance. And my rule of thumb is like whenever I see something that just has that like crazy hook and I think it's probably BS, I usually just keep scrolling.
Yeah, it takes willpower too, because sometimes I'm like, well,
yeah, that's true.
What are they going to show? Or
what are they going to say? Yeah.
It's important that we're doing what we're doing, right? To try to put good information out there. It's not clickbait. We're not like, telling people buy this, buy this, buy this. We're just trying to really give education so that people can make smart decisions and choices, because it can be overwhelming. You're constantly being bombarded. So I also tell people, like, find someone who resonates with you, like you like their message, you jive with what they do, their approach to skincare, and they have the knowledge, and then follow them and kind of have that trusted resource. Then you're less likely to, fall for all the clickbait out there. So
yes, absolutely. And I'm sure you have people send you videos too, like, what do you think of this? And I'm always happy to give my opinion to a follower who sends me something like a crazy video. I don't love to like publicly shame other creators or brands or products. I'm very like private in that manner where I talk about what I like, what I think works, but privately in the DMs, I'm always happy to give you my honest opinion. I come from a family of small business owners, and I think it's like that feeling of like the negative review in me where I'm like, I never want to give a negative review of somebody. I just want to share the information. Of course, if it's harmful, I will, but I just like to give the correct information and then hope that people can kind of sift through the rest.
Right. That's another issue with everyone typing behind their computer. And yeah, people can be pretty harsh, and just trying to be tactful and still gracious, but still give good information is smart. And hopefully, reason can rise up and people will know to look beyond that kind of stuff. But yeah, sometimes it can seem overwhelming. Now I'm getting sent videos of people like taping their mouths and all this crazy stuff to go to bed. I'm like, oh my goodness.
You know what I will say? So I tried the mouth tape and my husband tried it too. And I have never slept so well in my entire life. So I don't know what it is. I don't do it religiously, but I tried it for like a good 1 to 2 weeks and I slept so good. But the adhesive definitely irritated my skin a little bit.
Yeah.
Yeah, it wasn't fun to take that tape off in the morning.
So you're in Miami, right? So I'm sure you see some like extreme cosmetic stuff. Are there any like go-to cosmetic procedures you just love, or anything you wish would just go away?
Yeah, I mean, I think neurotoxin is always going to be a tried and true. I think it's an easy introduction into the world of cosmetics. And most of the time, what bothers people the most are like these lines here between their eyebrows or around their eyes. I do have like my approach to everything, a very conservative approach to that, especially because my patient base is so young. I will often either send them away or tell them, like, you don't need to be in this office every 3 to 4 months. Like, I don't care what the company is telling you. You have great skin integrity. So once those lines start to form, they're not going to be etched in forever. It's different when you're coming in at 50 or 60 and you have those etched in lines. So I love neurotoxin. I like Botox or Dysport. I love Sculptra, those kind of biostimulators. Anything. I love microneedling. Anything to help my skin work better. Of course, we also employ fillers in our practice. I've definitely moved away from it a lot more now that we have other options, but there's still a time and a place for that. Absolutely. My patients will say I'm like very, very simple in my approach. I love microneedling. I love Sculptra. I love toxins. Again, especially because I have that younger patient base that doesn't need as much.
Those are some of my favorites too. And of course, like we've gone too far with the tweens and the teens, right?
Yes.
Like that's too much. But yeah, like just helping 20-year-olds know, hey, don't drink excessively, wear sunscreen, start on a retinoid probably in your late 20s. Or if you have a lot, there are some people in their 20s who do have very dynamic lines on their face and that could benefit from that. But, just really instilling kind of the healthy habits in your 20s, I think is really helpful because you can kind of fake it till you're about 35 or late 30s. And then that's when you start to see the damage. So if we can, prevention is so key. And I'll say like little tweaks along the way, little things along the way can really stave off feeling like, oh my gosh, like I have all these things I need to get done or you're unhappy with. That can make a big difference. So I love that. It's much harder when someone comes in their 50s or 60s, they've never done anything. But still, when that does happen, I'm always like, let's start with like your skin integrity and complexion, because if we can get your skin uniform and even and remove any sort of dyspigmentation, it makes everything look better. The lines, the laxity, whatever, everything looks better. So that's always kind of where I start, is like, let's make the canvas beautiful and clean and fresh.
And I echo that completely. I'm sure you have those patients who are completely interested in skincare. They just want to come in every quarter for their treatments, and it never fails. I do skincare with all of my patients. That's the first part of their visit, because I really believe it's in it so strongly. But there's always people who aren't interested and don't take the advice. And then, they come in for their second or third Botox treatment and they're like, well, these lines are gone, but how come, this is still here? My skin still looks like this. And I'm like, because Botox doesn't treat your skin. It's not treating the canvas, exactly like you said. And when we do treat that, it goes so much further, because your skin reflects light better, and the eye of the person looking at you just responds. It understands your skin as being more youthful when it looks more healthy and radiant.
Now, what are some of the things you were like, this is not worth the hype, I wish it would go away, like overhyped, anything? Because I know you love like products, and even though you keep it minimal, you try a lot of different things, but anything that's overhyped needs to go.
Okay, so I will say that these things are overhyped, but not that they need to go, and I'll explain myself. So I think niacinamide and hyaluronic acid are totally overhyped, but both are really amazing ingredients. The problem comes when, especially with niacinamide, where it's put in everything, because now brands recognize that the consumer loves niacinamide. So it's in your cleanser, it's in your serum, and it's in your moisturizer, and it's in your sunscreen. And that's when we start to see irritation. And then people who say, I can't use niacinamide. Well, that's probably not true. You just can't use it in every step twice a day at these higher concentrations. And we know from the data that really the sweet spot is like 2 to 5%. That's what's most effective with niacinamide. But then we have brands formulating with 20%, because higher is better, right? In the consumer's eyes. So things like that, I think, need to go, where we just get so obsessive over one or two ingredients and it's in everything, or also ingredient shopping in general. I'm not a fan of using brands that are like, I wouldn't say, I do use these brands, but formulating a routine that is like 10 steps because you had to get in your hyaluronic acid, then your niacinamide serum, and then your azelaic acid serum. No, like I mentioned on my show, find the product that targets your concern, and often it will have a combination of the right ingredients rather than you having to play chemist and make that yourself.
Find the product that treats your skin concern, and not just every ingredient, getting a product for all of that. And yeah, to your point, like hyaluronic acid, niacinamide, these are already most likely in the products you're using. You do not necessarily need to go out and buy a separate one. So flip your bottle around, or whatever your product you're using, and actually like read the label and look and see what's on it, because you probably don't need to go get those extra things. They're probably already in there. So yeah, I'm totally with you on that. Like, they're great products, but you don't need to have a separate one and high concentration just for that. So great advice there. All right, Amy, this has been like super fun. I love talking with people who, take care of skin and are educated on it. What are your top 3 tips? Let's do like summer tips for people, since we're in the summer, for the listeners.
Sure. So, number 1 is going to be sunscreen, of course. I always tell my patients and my followers, if your concern is evening your skin tone, anti-aging, anything to do with the way your skin appears, and you're investing in a regimen or even procedures, but you're not using daily sunscreen, you can throw it all in the trash. It really is that important to your cosmetic needs, wearing a daily sunscreen. So that's for sure going to be the number 1 tip. I'm sure most experts will say that. And 2, I think keep it simple. I think simplify to those products that are tried and true, those ingredients that are proven to move the needle in your skincare routine, and then build from there. See, another summer skin tip. I think not relying on sunscreen as your only measure of protection is really important. Making sure you're wearing the hat, the UV clothing if you have it, but really like a hat and seeking shade. Seeking shade is the biggest one, because I find that people will just put on their sunscreen and go sit out on the beach without an umbrella and think that that's enough. And it's never going to be enough. You have to be out of the direct sun. Doesn't mean you can't go live your life. Doesn't mean you can't go play in the water with your kids. But if your skin health is a priority, using multiple measures of sun protection is really important.
Yeah, I love that you included that last one, because that's where I think a lot of people get into trouble in the summer, is they think sunscreen is this like invisibility cloak or something that the sun can't penetrate. And yeah, invariably people don't apply enough. They don't rub it in all those spots, and then they get burned. So yeah, seeking shade, and you can still live your life. You can still go out and do things, but it just, be smart about it. Sit at the table for lunch in the shade versus in the direct sun. Oh, and I remembered what I was going to ask you because I'm like real basic with my skincare and I get most of my products at the drugstore. Are there any products that you are like, nope, this is worth a splurge?
Oh, yes. Yes, there are a few for me. One of them is the vitamin C that I use often. It's the Revision vitamin C. They're C+ correcting. They use THD ascorbate, which is a lipid-soluble form of vitamin C. So it penetrates without the need of a low pH formulation like L-ascorbic acid needs. And I find, since I have rosacea, I'm very sensitive, that L-ascorbic acid can sometimes irritate the skin. So I do splurge on that vitamin C. For me, I have found very few of my patients who can't tolerate that, who have sensitive skin. So it's my number one choice for vitamin C for sensitive skin. And it's one that I repurchase all the time.
Well, great to know. And I do think if someone's looking for the drugstore version, I do think Vanicream makes one as well.
Yes, they have a THD. Mm-hmm.
Yeah, because that's a great point. If you are like, oh, I can't tolerate, ascorbic acid, give that a try. That it's a little gentler on the skin too. So love that little tip there. It's been a lot of fun. Amy, where can our listeners find you, follow you? I know they're going to want to check out your podcast, Skinthusiast. So where can people keep in touch with you?
Yeah, so the podcast is #Skinthusiast the podcast, available wherever you get your podcasts. And then my website is skinthusiast.com, and I'm at Amy Koberling on Instagram.
We'll include all that in the show notes, and I really appreciate your time. This has been so much fun. Thanks so much.
Thank you for having me.
We'll see everyone next week.